a series of virtual sessions initiated by Takshila Educational Society to propagate diverse themes, thoughts, and perspectives. In order to facilitate better understanding of our world and its concerns, we bring articulate speakers from all walks of life on this platform to further ideas that foster learning, self-expression, and ingenuity. In this session titled Family Preparedness During COVID-19, our speaker, Pranav Sethi, outlines the steps to prepare and protect our homes during the pandemic. Pranav Sethi is a professional who works towards disaster risk reduction and climate change mitigation. He holds a master's in disaster management from Tata Institute of Social Sciences and is engaged with the Geohazards Society, an organization instrumental in conducting numerous safety and preparedness projects in association with government and non-government agencies across South Asia. The speaker would converse for about 30 minutes on the topic. You may submit questions through the chat box of your YouTube channel. All questions from the viewers would be answered collectively by the speaker in the last 15 minutes of the session. We now begin. Over to our speaker, Pranav Sethi.
Thank you, Sitika. Good day, everyone. I'm Pranav, and I'd like to thank Takshila Education Society for giving us this opportunity to share this information on disaster preparedness, family preparedness, and COVID-19 with you. I will be talking using a series of presentation slides, so please bear with me. Let me just connect with the slides and we can start after that. So we are going to talk about family preparedness during COVID-19, and so we'll start with try to understand what exactly is COVID-19. COVID-19 or SARS-CoV-2, also known as coronavirus, is a virus that belongs to the coronavirus family. The same virus family is responsible for viruses like MERS and SARS. MERS stand for Middle East Respiratory Syndrome and SARS stand for Severe Acute Respiratory Syndrome. Both these viruses have been responsible for a number of deaths in the last few years. So how does the virus spread and why is it so dangerous? As per the World Health Organization and after the initial few research, it is found that the virus spreads from human to human, and they are spreading in the form of droplets of saliva that are released during coughing, sneezing, and even while we are speaking. The virus also spreads in case if we get in touch with the contaminated surfaces. So when we cough or sneeze, the droplets of saliva, they settle down on tables and railings and our computers. And if we touch and then we touch our face, there's a probability that the virus can enter our body. What are the symptoms? Since the virus is new, the disease is new, we don't know much about the symptoms, but the World Health Organization has come up with few symptoms such as cough, fever, and in severe cases, it can also lead to pneumonia-like symptoms. One important thing that you need to understand is these symptoms may come between 2 to 14 days. And as per the latest information shared by the Indian Council of Medical Research, 28% of these patients who are diagnosed with COVID-19 are asymptomatic. That is, they don't even show any form of symptom of the disease. Few additional symptoms that have come up over the last few days are aches and pains in the body, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste of smell, rash on skin, or discoloration of fingers and toes. If you have any of these kind of symptoms, please consult your family doctor over the phone, share your symptoms with them, and wait for them to suggest the next step of action. Now, the disease is preventable. It is not like, once you get infected, there is nothing that you can do. You can actually prevent yourself from getting infected. So if we follow a couple of steps, we can ensure that we don't get infected by this particular disease. We can start with, whenever you are going out outside your house, please ensure you wear a face mask. Also, please ensure that whenever you are wearing a face mask, you cover your mouth and your nose properly. When you are venturing out, you can be going out for grocery shopping or any other activity. Please ensure that you maintain at least 2 meters of distance between yourself and others. Also, remember, you have to wash your hands often. In case of absence of soap and water to wash your hands, you can always depend on alcohol-based hand sanitizers. But please wash your hands with soap and water after using the washroom, whenever you are coming in from grocery shopping or from any other place. Please wash your hands. If you are taking care of elderly or any infant, wash your hands. And before and after cooking, you need to wash your hands using soap and water. One important thing that we all have to practice is we have to try and not touch our face. This is very important. We discussed this earlier also. The disease can be transferred from touching the contaminated surface. So if we touch our face very often, there is a probability that we may infect ourselves. And last but not the least, please eat healthy. Eating healthy will help you build immunity. People who are smoking or vaping, they are affecting their body, and you need to understand that a smoker's body is more vulnerable to COVID-19. So please refrain yourself from smoking or vaping in the next few days. It's not good for your health. Few good hygiene practices that one can adopt that few good hygiene practices that one can adapt to prevent the spread of disease is, for example, if you have to cough or sneeze, please cough or sneeze in a tissue. If you don't have access to tissue, you can always cough or sneeze in your sleeve. So to cough or sneeze in your sleeve, what you need to do is fold your arm like this, cover it with cover your nose and your mouth like this, and sneeze it over here. In case if you have coughed or sneezed in a tissue, please dispose the tissue off in the dustbin. Do not leave it out in the open or throw it on the street. Dispose them off properly in the dustbin. After coughing or sneezing, please wash your hands using soap and water. And only in the absence of soap and water, go for alcohol-based hand sanitizer. Few other good practices that one can adopt is washing our hands. Sometimes when we ask children to wash their hands, what they do is they just put their hand in the running water and come out and say they have washed. No, you need to wash your hands using soap and water for at least 20 seconds. You can also reinforce this by teaching them to hum the happy birthday song while washing their hands. To wash our hands, we have to follow a couple of steps. Please remember this. When we are washing our hands, you wet your hands first, apply soap and water, rub your palms like this, then interlock your fingers and rub them like this for a couple of seconds. Make sure your fingertips are also clean. So just put your fingertips in your palm and move them like this for a few seconds. After that, please ensure you wash your thumbs. So hold your thumb and just rub it like that. Once you are done with that, don't forget the back of your palm. So rub your back of your palm and you finish it off by rubbing your wrist like this and washing it under running water. After you have washed the soap off, clean your arms or clean your hands using a dry towel or a dry tissue paper. And don't forget to dispose the tissue paper in the dustbin after your use. Another important thing that we need to adapt in the coming few days is to wear a mask. Now, You can always go for a surgical mask or N95 mask, or you can always make your own mask. But wearing it properly is the key to success. When we are wearing a mask, we are preventing the release of droplets of saliva by when we cough or sneeze. And we are also preventing the intake of these droplets in from the atmosphere around us. So please ensure that whenever you are wearing a mask, you cover your mask, you must cover your nose and your mouth properly. Do not do not wear your mask in a way where your nose or your mouth is exposed. It is not going to solve any purpose. Also, when you are taking your mask off, please ensure that you hold your mask from the strings from either from behind your ear or behind your head and take it off. Sanitize your mask every day using detergent and water, or you can also use soap. But you need to wear a mask whenever you are going out, and in case if you have someone in the family who is tested COVID-19. In both these conditions, you need to wear a mask every time. So till now, we have discussed what is coronavirus or COVID-19, how does it spread, and now we will talk about, come to and discuss about lockdown and family preparedness. Lockdown, we have been in this particular situation for almost 2 months now, and lockdown exactly what exactly it means is it is trying to we are trying to restrict our movement by staying indoors. We are not going out, and that is what we call lockdown. The entire nation was under lockdown for almost 2 months, and now it is trying to get back to this, or what we call is the unlock phase. We are trying to get back to the situation how it used to be before lockdown. But we need to understand one thing: schools and businesses may not function like that over again for the next few days or weeks. There's a probability that we may have to study or work from home for the next few more days. And in the next few slides, we will learn how to do that more effectively, how we can ensure that our family is practicing, is safe during these situations. So how can we prepare for lockdown and post-lockdown period? Even though the lockdown has ended and we are trying to get back on our feet again, but there's a probability it may happen again. It may be initiated again. So what we need to learn and practice is we need to practice, we have to limit our socializing. We have to limit our social interactions with other people outside. Please maintain physical distance whenever you are going out. Do not interact with people. Think of the people outside as a potential COVID-19 carrier, and we have to maintain some distance between ourselves so that we can prevent the spread of the disease. um, when we are buying essential items for our home, including groceries and hygiene products, please ensure that you buy at least 6 to 7 days of supplies in one go. By doing so, what we are trying to do is we are trying to limit our social interaction and physical outings, and by doing that, we are actually reducing the probability of spread of the disease. In case if we have family members who need few medicines on a regular basis, such as people who have diabetes or high blood pressure, they may need medicines on a daily basis, and we need to ensure that we procure these medicines and keep a stock of at least 1 to 2 weeks. People who are who have existing health conditions are highly vulnerable to the disease, highly vulnerable to COVID-19. So we have to limit their physical outings, and we need to procure medicines for them for helping them sustain for at least 1 or 2 weeks, and we need to procure these medicines beforehand. You can always prepare your own face mask The market is filled with different kind of face mask, whether it's a cotton mask or surgical face mask or N95 mask. You can always use any one of them. Just remember, whenever you are using a face mask, the mask should cover your nose and your mouth properly. It should not be placed in such a way where your nose or your mouth is exposed, or else it will not solve the purpose. At home, please ensure that only one family member gets to go out for grocery shopping or to buy any household commodity or any kind of essential supplies. By doing that, we are again limiting our family's exposure to the disease. So ask only one person to do all these shoppings for you. Whenever you are going out, please ensure you are taking protective measures such as wearing mask, maintaining some physical distance between yourself and others, or sometimes nowadays people are also wearing a face shield. Please remember that the face shield is not a substitute for the mask. You still have to wear a mask even if you are wearing a face shield. So practice these methods whenever you are going out in the next few days. One thing also that you need to remember is that elderly people and people with existing health conditions are highly vulnerable to COVID-19. So limit their interaction with the rest of the world and try to maintain good hygiene at home so that their vulnerability to the disease decreases or lowers. We'll discuss few important do's and don'ts that one can adopt to reduce the spread of the disease. Let us start with few do's. On returning from outside, after let's say grocery shopping or any other activity, whenever you come back, you remove your shoes and slippers at the door. Immediately come inside, wash your hands using soap and water. If possible, remove your mask using the strings and sanitizing it using detergent and water. Whenever you are going outside for any kind of shopping, grocery, or medicine, try to limit your use of wallet. If possible, you can carry the exact change, or if possible, if you want, you can follow the e-payment using your mobile or your ATM or credit card. Also remember, whenever you're coming back after using your mobile or debit card or credit card, sanitize them. What you can do is take few drops of sanitizer on a dry tissue paper and just wipe them clean properly. We have discussed this earlier also. Please practice good hygiene at your space of study or wherever you are working or inside your house so that your vulnerability to this disease decreases. Whenever we are buying any kind of fruits or vegetables or non-vegetarian items, please ensure you wash them off properly. Do not wash them using soap or water, or do not wash them using sanitizer. It will not taste good. It will not be healthy. Just put them under running water for a few minutes, rub them off, and that's all. Also remember, before and after cooking, you need to wash your hands. Once you are done with washing your vegetables and fruits, whenever you are cooking them, please ensure you cook them at high temperature. Do not consume anything that is raw. Just ensure that whatever you are cooking is cooked at high temperature. In case if some of you are returning from, if you or your family members are returning from highly contagious areas, these contagious areas could be hospitals or dispensaries. Just ensure that the moment someone comes in, they remove their shoe or slipper at the entrance, immediately go to the washroom, remove their clothes, and have a bath with soap and water. You need to wash their clothes separately using detergent and water. By doing this, you will be able to actually prevent the spread of disease and make your family members less vulnerable. Let us discuss few don'ts now. Couple of things that we need to learn or unlearn in the next few days. Do not touch your face. Stop touching your face at any point of time. Like we discussed earlier, if we touch contaminated surface and if after that we touch our face, there is a possibility that we are exposing ourselves to the disease. So stop touching your face. If you have to sneeze or cough, use a tissue or you can always sneeze or cough in your sleep. Please avoid spitting in the open. Spitting in the open is a punishable offense and you can be fined for that. After using your tissue, your mask or glove, do not dispose them off out in the open. Dispose them off properly in the dustbin. Whenever you are going for grocery shopping, buying vegetables and fruits from the market, please ensure you do not buy any kind of cut vegetables or fruit from the market. In case of non-vegetarian items, there is no other option, but we have to buy them like that. Bring them back home and wash them properly. And after that, cook them at high temperature. Avoid any form of physical contact with the outside world. You don't need to shake hands with everyone. You don't need to hug anyone. Please maintain some physical distance so that the probability of the spread of disease decreases. Lockdown is not a time for family picnic. Don't think of it like a holiday. In the next few days, our chances of going on a holiday is not looking so good. We have to maintain as much distance between ourselves and the rest of the world. We were discussing this earlier also. Think of all the members of society as a possible candidate of coronavirus or COVID-19. So maintain as much distance between yourself and these people as possible. In case if you are feeling sick, if you're not feeling well, do not self-medicate. The moment you feel you're not well, contact your family doctor, share your symptoms with them, and let them decide the next course of action. Please do not self-medicate. Self-medication at this point of time is really harmful. We also should not forget that alcohol-based hand sanitizers that which we are using often now are highly flammable. So make sure whenever you are using a alcohol-based hand sanitizer, you stay away from active flame. Do not store hand sanitizers close to the active flame or in the sun or in a hot area. Save them or place them in a cool, dark spot where they can they can sustain easily. Till now, we have discussed about COVID-19, how can it spread, and we were discussing about few do's and don'ts that will help us in the long run. In the last few weeks, during these lockdown time, many of us have been studying or working from home. And to be doing that effectively in the next few days, we need to learn a couple of things. Working and studying from home can be productive. It may be difficult because we are not used to it, but it can be productive. We can learn few important things which will help us in the long run in the next few days. In the next few slides, we are going to discuss about how to be more productive while staying at home or while working or studying from home. Having a workplace and a computer. A workplace could be any space in your home where you are not distracted or disturbed. It could be a separate room with a table or a chair. It could be your bedroom with a table or a chair. Or it could be any corner in the house where you can sit and work without any distraction. Please ensure that your place of work or place of study resemble your school setup or your office as much as possible. Because then only you will be more effective, more productive. Also, try and avoid studying or working from your bed. Chances are after a couple of days, you will end up with backache. So always use a table and a chair while working or studying at home. Have To study or work from home, you need to have a device, an electronic device such as a computer, laptop, or a mobile. Just ensure that whenever or whatever device you are using, you don't distract yourself while using that. Sometimes our mobiles, our computers have access to social media, games, and we have to ensure that when we are working or when we are studying, we don't get distracted because of these devices or because of these social media accounts. Let us go to family and schedule. Having a schedule or a timetable help us in the long run. Prepare a timetable of your daily activities, your weekly activities, your monthly activities. This will actually help you plan your day, plan your activities, and will help you become more productive. Even at school, when you are using every school, every class has a timetable. The timetable actually spreads out the classes evenly across the year so that everyone gets enough time to complete their syllabus. At the same time, you are not overburdened with one particular subject. So plan it out. Plan your daily activities, your daily schedule. Everything needs to be planned so that this will actually help you reduce your anxiety while you are working or studying from home. Once that timetable or your daily schedule is prepared, share this information with your family. Let your family members know about your workplace, from where you're going to study or work, your school timing, your office timing. Inform them about the kind of device you are going to use to study or work from home, whether it's a laptop or a mobile, so that they are aware about how you plan to go ahead during these time, and they can reduce any form of distraction during your school hours or your office hours. Health and breaks, a very important aspect that we need to follow during our phase of working from home or studying from home. Think of your work from home or your study from home activity as any regular day. It could be any regular day at school. If you're not feeling well, get some rest. You don't have to overburden yourself. And if you're not feeling well, take some rest, take some time out. And that is what we are calling taking a break. You cannot continue to work or study 24/7. So take few breaks after every few hours. And this is especially for the children. When I'm talking about taking a break, don't let your break turn into 2 or 3 hours of break. Make sure that these breaks are for few minutes. After every few hours, take a break, go out, take a walk around in the house, look outside the window, stretch yourself, just give yourself some time to do any form of activity so that you can continue to focus on your work in an effective manner. How to ensure good mental health and good physical health during this time? Please ensure that you are able to spend some time on your mental health. If you like to meditate, you should meditate. Plan it out, plan your day out, plan your daily activities so that you are able to lower your anxiety. Give some time on physical workout. Physical workout can be about dancing, aerobics, or any kind of physical activity. It could be even walking around in the house. So give yourself some time during this phase to work out and keep your mental and physical health in a good shape. Now, what happens if someone in the family is sick? They may or may not be affected by COVID-19. But in that case, how do we prepare? One thing that everyone needs to understand is we need to learn the contact details of the family doctor. Everyone should be aware about who this person is and how to contact them. Your family doctor will know the history of the family. Your family members should be able to contact them, share your symptoms, and after that, whatever the doctor suggests, you can use that, you can practice that. Create a mutual health plan with the family staying nearby. A mutual health plan is about informing or getting in touch with another family. This could be your neighbor, could be your friends who are staying close to the vicinity, and these people can come and take care of your family, or can keep a check on the family during these difficult times. Ensure that everyone in both the families during the mutual health plan, please ensure everyone in both the families are aware about the plan. And also, please make a list of all these contact numbers, all the contact details, emergency contact details of both the families, so that in case someone is not feeling well, you or anyone in the family is well aware who to contact and how to get in touch with them. Now, what happens if someone in the family is tested with COVID-19 or is COVID-19 positive? You need to understand one thing: people who are tested positive are also recovering. It is not a very deadly disease. It is contagious, surely, and people are able to recover. So, what we need to do is, wherever you are, in whichever city or state you are, you need to identify the list of the testing centers, the COVID-19 testing centers, the COVID-19 hospitals that are dealing or treating people diagnosed with COVID-19. List them out and also identify the list of ambulances or services which are helping to transfer patients from their home to these hospitals. You list them out, prepare a plan so that everyone knows, in case if someone is tested tested positive for COVID-19, how they can get in touch with these testing centers and the hospitals. Also, you need to identify the contact details of the health department of your state or your city. You need to inform them the moment someone is tested positive for COVID-19. You have to inform the health department so that they can take necessary actions to prevent the spread of the disease. In many places, people who are tested with COVID-19 are being asked to self-isolate. Self-isolation is not that difficult. What we need to prepare, how we can prepare for it is, we need to identify a room in the house with an attached bathroom where this patient can stay. Please ensure whosoever is using that bathroom is that particular bathroom is dedicated for only the COVID-19 patient at our home. Also, if someone is tested positive at home, please make sure you wear a mask at home to prevent the spread of disease. You also need to ensure that you are able to provide food to these people, whosoever is tested COVID-19 positive, from a distance, by maintaining some physical distance between yourself and them. Try and provide them with provisions to wash their own utensils and their clothes so that the spread of disease can be controlled or maintained. Towards the last of our session, I'll just quickly discuss about a very important aspect. COVID-19 is a serious case we are dealing with, but another important thing that we have to fight over here is the trend of fake news. You all are getting some of the other information on your social media accounts or WhatsApp, and many of these turns out to be fake. So you need to understand one thing: spreading of any form of fake news during these times is a punishable offense. Under the Disaster Management Act, people who are found to be spreading any form of fake news can be arrested. To keep a track on the correct information, you can always depend on the website of Ministry of Health and Family Welfare or your state health department website or always you can always go to the World Health Organization's website for any form of information about COVID-19. Please refrain yourself from sharing any kind of forward message that you receive on any form of social media account, unless and until you have checked if it is valid or check if it is authentic or not. That is all for today. I'd like to thank Takshila Education Society for giving us this opportunity to discuss family preparedness and COVID-19. In case if you have any other query, please feel free to write to us at delhi.geohaz@gmail.com. Okay, so I have received a couple of questions and I'll try to answer all these in the next few minutes. First question that we have is, now that the lockdown is being lifted, there is an even greater risk of infection, as is evident from sharp rise in the number of new cases daily. How do we adjust to the safeguard? How do we adjust to safeguard our family in this situation? Like we discussed a few minutes back, we have to adjust to the social distancing norms or the physical distancing norms. So try to limit your family's interaction with the rest of the world. Try to limit how many people from the family are traveling outside on a daily basis. This is There is no other option that we can adapt right now. Whenever you are going out, please ensure that you cover your mouth and your nose using a mask and maintain physical distance of at least 2 meters with other people outside. Outdoor playtime, the next question I'm going to next question now. Outdoor playtime with friends is an absolute must for healthy growth of kid, not just for physical health, but also for life skills and interaction with kids their age. So going forward, what would be the best way to protect kids without them having to forego this important activity? I totally agree to this that children need to go out and play. This is really important for their physical and mental health. But we have to understand these are really difficult time. And like we were discussing, there are other possible ways of having some social interaction with our friends and family. We can always rely on video chats and calls. So that is something that will cover the social interaction part. And about the physical activity, we were discussing about doing physical activities at our home. So if someone you can try out different activities such as dancing, yoga, aerobics, even walking inside the house or playing inside the house will help. But because this is a difficult time, we may have to forego with the idea of two children or two or more children playing together out in the open, because this is a highly contagious disease and we have to take as much precaution as possible. I'll go to the next question now. We see evacuation plans and drills in the public places, offices, and even our ward schools now. Is there a way to develop our personal evacuation plan for homes? Please suggest ways to draft such plans. Um, okay, this is a bit away from the COVID-19 topic, but yes, you can always prepare an evacuation plan for your home. What you need to do is, beside evacuation plan, you need to have an evacuation kit, something that you can take immediately along with you while you are evacuating. Identify a place where you all have to gather outside your house. Identify the route that you will take to reach that place. Ensure that in the path there is nothing that can fall or nothing that can obstruct your path. Also ensure that exits in your house are not blocked by anything that has been stored over there. Please ensure that there are at least two exits for each and every house or each and every building, so that in case if the first exit is blocked, you can always depend on the second exit. Keep your path from your exit path clean of any form of obstruction. No planters, no trees, or no plants on the way, nothing on the staircase. They should not be locked or blocked in any form. Also, have an emergency kit for your family prepared. The emergency kit will have few supplies such as something that can last for 3 days, couple of water bottles, some medicines for your family, some first aid kit, important documents. You can keep it in a pen drive and put in your emergency kit, or you can email it to yourself. Few clothing items, some personal hygiene items. If you have, if your eyesight is weak, you may have to keep your specs also in your emergency kit. And the moment you have to evacuate, you immediately take your emergency kit and go outside and go towards the evacuation area that has been decided beforehand. How do we discuss emergencies in an age appropriate manner with children? My children are in class 1 and 3. We want to make them understand how serious the pandemic is, but we don't want to scare them unwisely. Talking to children about such difficult situations can be a bit tricky. So, to discuss this kind of information with children, with primary class students, we sometimes practice the idea or the concept of storytelling. We prepare a story around the topic and we narrate it to the children, and we add the concept of the what is good and what is bad, or you can always say what is always the best thing that the student the one a child can do, but bring it to a level where the child will understand. You The storytelling concept is always helpful, especially when we are dealing with children of class 1 and 3rd. Next question is, are there book, manual, websites one could visit for more details on family preparedness? In case you don't have it in handy, please mention it, share it, list with Takshila to share with viewers. Okay, to discuss more about family preparedness, you can always visit our website geohaz.in, geohaz.in. Uh, Beside that, the National Disaster Management Authority of India has information about family preparedness. You can visit their website also, and you can learn more about how to prepare your family for various hazards. Do we have to keep, going to the next question now, do we have to keep social distance with our family members also if we don't go out? See, we have to maintain physical distance with the rest of the world. In case if we are at home, we don't need to wear a mask, we don't need to maintain any kind of physical distancing with our family members. But in case if someone is not feeling well, or if someone is tested COVID positive for COVID-19, in that case we have to maintain physical distance. In that case, we have to wear a mask at home as well. Is there any way to improve our immunity? To improve your immunity, you need to be in a good mental and physical health. Eat healthy, listen to your mother, eat all the vegetables, and stay away from junk food. Okay, so that is all for today. I hope I was helpful to all of you, and I wish the best for each one of you who attended this session. Please make sure that you all practice physical distancing and always wear a mask whenever you are going out. Work and study from home and be safe. Thank you.